Greetings, everyone. Thank you to WHO's regional office, UNICEF's regional office, and ESA for the invitation to be with you today. So greetings from the Center on the Developing Child at Harvard University. If you don't know our center, our core mission is really to take the rich and ever-growing body of knowledge from multiple disciplines about how human development happens, particularly in the earliest years of life, and to sort of translate that and make that accessible and usable for those of you who are concerned with and committed to improving conditions for children and family all over the world. I will say that I am not a researcher in the sense of my background is not in the research and science of child development. I am a good example of how the way our center's content can help all of us both understand and use this knowledge base to advance the work that we're trying to do. So, what I want to do in the time that I have is cover sort of three major points. And what we're looking at is how does this knowledge base give us collectively insights and tools to think about the work that we do, how we can improve it, and to be attentive to what's going on in the young children and families we're working with. So we're looking at resilience as sort of the goal here. And I want to talk a little bit about why are these early years so distinctively important, to talk a fair amount about the reality of stress and adversity and what that's doing in the body, and then really look at the concept of resilience and how that gives us some tools and principles to think about the work that we do together, particularly looking at the healthcare setting, which is the focus of today's webinar. So, children birth to 5, it's not just that they're little and young. There is a distinctive phase of development that's happening in these years that is unique and is setting foundations for the rest of our lives, not in a determinative way, but in a foundational way of setting us up for either positive adaptation or some negative consequences. And what we know is at birth, we have all of the neurons and cells in our brains, but there's very little connectivity. That connectivity, what we call brain architecture, the wiring and connection in the brain, is being built in the context of relationships and early experience. So we have to think of this as building over time, starting with really basic circuitry, and then moving on to more complex, sort of higher executive functioning and so forth. And so this happens in the interactive relationships between infants and their caregivers and others that are interacting with them in their environment. And so that environment and those experiences, whether they are good or bad, are sparking the signaling and connections within the brain and building these different circuitries and therefore capacities and skills. So we can think of this as like building a house, sort of that early foundation, and the stronger that foundation is, the more stable and productive everything that's being built on top of it will be. So why is this early period so important? And here we want to talk about a concept known as brain plasticity. And so in these early years, as all of this wiring and architecture of the brain is being developed, the brain is most open to adaptation. As you will see here, over time, that plasticity or adaptability declines, and it does that for a very important reason, because what we are using and doing over and over again, the brain is reinforcing and becoming more efficient at that, and then pruning away those circuitries that are less important or not being used. And so over time, it takes more energy and more cost, if you will, to make adaptations, to address sort of the kind of capacities and skills. And as I'm sure happens for all of us, you immediately went and looked at that sort of horizontal axis and found your age. Don't worry, that line never goes to 0. And so if you wake up tomorrow morning and remember something new that you heard today, you built new synapses in your brain. So it's not a lost cause. But what's important here is we have an opportunity in these early years to set these foundations and to develop the kinds of capacities and skills that can serve us well throughout life. And so the headline here is timing matters. And so when we think about exposures to adversity or positive experiences, how children respond to that and when they're exposed to that really matters. And so across a range of different factors, whether that's exposure to sort of chemicals and toxins, we know about lead, exposure to violence, that depending on when that happens, and if that's a 2-year-old that's having that experience versus a 10-year-old or an 18-year-old or a 25-year-old, how those experiences are affecting the development of the brain and other bodily systems is important for us to pay attention to. And so in these earliest years, these developing systems are the most sensitive to their environments. And so let's talk about stress. This phrase toxic stress has been out there about for a long time. And what we're talking about here is that it's important for all of us to learn how to cope and to deal with adversity and challenges in our environments, in our lives. And if that stress is significant, extended, it can have damaging effects in different circuitry and parts of our brain and in other biological systems in our body. And what's important here is to understand that we're actually talking about 3 types of stress response. So toxic stress is the phrase that has gotten sort of popular and used, but it's important to understand it sits in the context of 2 other dimensions of how we're responding to stress in our bodies. The first is to understand that there is positive stress, that for young children in particular, learning how to sort of cope with their environments, to deal with fear, to deal with challenging situations like going to the doctor or going to preschool or in the normal life. And so we all know what that stress response feels like, right? Our heart rate goes up. We might get a little sweaty on the palms. There's some anxiety there. But in the context of supportive caregiving relationships, this is buffered and sort of brought back down to sort of normal levels. And it's the way that the body and the brain are learning to build these coping systems and regulate that kind of response. There are much more serious kinds of stressors in any of our lives, and particularly for children. And so I think in the context of this webinar and thinking about crisis situations, we're coming into, at minimum, a tolerable stress environment where there are significant adversities and stressors happening in the life of the child. And that could be displacement from conflict, a natural disaster, major health issues in the family, those kinds of things. And so that's a more extended experience of adversity in that child's life. And again, the key here is if that's happening in the context of consistent supportive adult relationships, that's helping that child sort of buffer and figure out how to cope with that situation. It's only in the prolonged, and when we say prolonged, we're talking weeks and months here, activation of that stress response system being elevated in the absence of the protective relationships that are provided by caregivers. And so I think the key here is that we are all quite adaptable. Our biology has been developed over eons for adaptation to success and coping and surviving. And so that the toxic stress is not something that happens in a couple of days. It's a persistent situation over weeks and months. And again, the key here is in the absence of having those caregivers who are supporting that child. Now, so we've talked about, this stress response, the fight, flight, freeze, those created by stressors in the environment. And for a long time, this from our center and others, have talked about the effect that this has in the brain, in brain circuitry, in how that shapes learning and other kinds of capacities. We also know, and I think this is particularly important as we talk about the health sector, there's a rapidly growing body of knowledge that the reality of this stress response process isn't just affecting the brain, that actually our bodies, surprise, surprise, are highly integrated, and it's a set of biological systems within the body that are highly coordinated. Each of them have their particular role. We can think of this as like a highly skilled team, soccer, volleyball, pick your sport, where each player has a particular role, but together they are working in a highly coordinated way. And so the brain is providing that kind of overall coordination and management. But if you think about the heart and cardiovascular system, our metabolic system, the immune system, and the neuroendocrine system, each of these have a particular role that gets activated in acute stressing moments. And when that stress and that threat goes away, those systems calm back down. Except in this situation where we've got this constant ongoing kind of adversity. And so what's happening here is if these systems are elevated all the time, it's creating a corrosive effect. And so if you think about longer term health challenges related to things like cardiovascular disease, hypertension, diabetes, even depression, and some other cancers, a lot of them have risk factors related to things like inflammation. And so again, that immune system, sort of that inflammatory response, is very effective and important in acute moments. If that stays elevated for a long period of time over time, that inflammation is a precursor for a lot of troubling and problematic things, both in physical and mental health across the life course. The same thing with the metabolic system, that glucose, getting that energy kicked up. But again, if that's chronic, we start to see factors like diabetes and other kinds of chronic disease. So the take home here is that our work to support families and young children is just as important for building foundations for lifelong mental and physical health as it is for strong foundations for learning, social emotional development, and school readiness and other kinds of life success. So in the context of crisis, I think we need to understand that this stress response is happening both in the child and in the adult. And so in this graphic, the red part of the brain with the exclamation point is the autonomic, the sort of automatic response part of our systems that gets triggered by threat and stress and other kinds of stimuli. The blue gears are the more sort of the cognitive, the executive function, those things that are part of our prefrontal cortex, the planful, thoughtful types of responses. So when there's this kind of constant stress and adversity in young children, as their brain is developing in the environment that they're living in, those automatic response parts of the brain are the ones that are getting more developed, if you will, because in the environment that child is in, it's reading, it needs to pay attention and have very good skills and capacities to respond to threat in that environment. And so that means there are other things that are less developed. They're not getting as much energy and attention in terms of those other executive function, regulatory, cognitive, and social emotional kinds of supports. These stressors are also affecting the adults. And so even if, in a situation where in our own development, historically, we have built good capacities in both of the kind of automatic and more sort of executive kinds of skills, when any of us are under stress, those automatic responses kick in. And I think any of us can sort of relate to, if we've been in an emergency situation or a highly stressful environment, we're not thinking about long-term plans, right? We're worried about what's happening in the moment. And so the double whammy here, and the really important thing to think about, is that stress is affecting the adult, which means that that adult doesn't have the kinds of capacities he or she would ordinarily have to provide that buffering responsive care to the child. And so the child is both experiencing that stress and it's not receiving the kind of support and care it would ordinarily receive from its caregivers in that kind of environment. And I think it's important to understand this as we think about mental health and the themes that we're talking about today in this context. And so what we know from a lot of research is that if there are mental health challenges in the caregiver, and we know particularly with the mother, there's a lot of research on maternal depression and other kinds of mental health issues. What's happening here, and the reason that's so critical and important, is it's getting in the way of that caregiver being able to be responsive. We talk about the serve and return interaction with children. And so it's disrupting those patterns and the ability of that parent and caregiver to be responsive. And therefore, in that context, the children are producing higher and more fluctuating levels of those stress chemicals that are then circulating and keeping that whole system of response elevated. And so, and we also know that again, this is not determinative, but that children who experience a lot of adversity early on have much higher risks for emergence of mental health challenges and physical challenges later in their life. And so I think often when we're responding to these challenges, and particularly in the health sector, often the adult and the child are treated as separate patients. And I think in particular here with young children, we really have to understand and look at this as the dyad, or as within the relationship. And so how are we addressing mental health challenges in adults in a way that's really understanding and seeing that that's in context of how they are relating or not able to relate to their children. And so, and young children, just the level of where their brains are, they're going to respond in different ways. This goes back to this timing concept, to these kinds of environments and situations than would older children or adults. And so we need to think of this as what's happening as setting foundations. And so it's both in the immediate term, but also what are we setting up in terms of that pathway over time. So that's the part of really trying to understand what's happening within the body and within these relationships from stress and adversity. Let's turn to a more sort of positive, if you will, side of this, and really talk about resilience and what we're trying to sort of support and help develop. As a definition, at its heart, resilience is a positive and adaptive response in the face of significant hardship or adversity. Now, there's some things that we know from the research around resilience that are important to stress, because they often run counter to the way that the idea of resilience is talked about in sort of popular and general terms. These capacities are built over time. Resilience is not a trait. None of us are either resilient or not. We aren't born with it. It's something that's built through experience and over time. And it is in the interaction of positive factors in our social environment and our own responsive biological systems. And it is built through a combination of, these things are all going to come up many times, the context of supported relationships, adaptive skill building, and the positive experiences in our lives that are forming this foundation. It's also really important to understand that resilience can be situation specific. It is not a generalizable outcome. And so I might be able to be resilient in a certain part of my life, but not others. I think one important example from people who experience a lot of structural inequity, there's a lot of research where they might be thriving and have figured out a way to be very successful in a career, and successful in sort of raising a family and economically, and there are often very significant underlying health issues. And so Some parts of us can be resilient and other parts may not be. We might be resilient in the face of a particular kind of adversity, but not another. And so again, this is not sort of a fixed thing. It's helpful to think about this as a scale. And so what are we putting on the positive side and what's happening on the negative side? So, things like conflict, displacement, poverty are negative experiences, are putting stress on the body, on relationships, and so forth. But there are a lot of things that sort of can weigh on the positive side of this. So responsive relationships, the kind of building a sense of agency, kind of the collaborative and coping skills, what kinds of services and social capital are we providing to families? And this is one that sometimes doesn't come into the conversation as much when we talk about biology and science, but there's strong evidence that shows that drawing on faith and cultural traditions is a really important sort of positive factor in helping build resilience. That sense of shared belief, shared practice, the speaking about sort of the history and legacy of a community. All of these things are really important in helping create coping situations. Now, there's one more part of this scale that's important, and that's that little fulcrum at the bottom. And here's where genetics comes in. So that fulcrum, there's a part of that that is determined by our genetics. We might think of this as temperament. Each of us is different, and our sensitivity to our environment is genetically based. And so where that fulcrum sits, as you can see here, if we go again, can make it easier or harder to get the kind of positive outcomes we want to see. So when that fulcrum moves as it just did, it makes it much easier for negative experiences to sort of tip that scale in the negative direction. Now, the good news is the fulcrum is not fixed. The genetics might set its starting point, but it is movable by the kinds of skill building and capacity building. And so if we're providing those responsive relationships to people, if there are opportunities to build that sense of self-efficacy and agency, that's actually moving that fulcrum so that as each of us experience challenges and adversity later in our life, we've built some tools and skills in coping and responding that can help us sort of tip that scale in a positive direction. The last thing I want to say about resilience is that as we've talked about this as a concept over the years, we've started to realize that we have to be careful, that it can end up making it sound like the responsibility to ensure resilient outcomes for children is left to the family and the caregivers themselves. And it's not, we're activating an assumption there that is not helpful, that it's all about family dynamics. And we're putting a lot of burden on families who themselves are being affected by things in their environment that are out of their control. And so we need to understand the kind of, quote, actors. What are the things that are helping shape resilience? What's pushing on different parts of this scale? And I want to touch quickly on 4 things. So we've talked about the role that family and community supports can play on the positive side. In the absence of those are then creating sort of potentially some negative pressures on this scale. What kinds of programs and services are available? Are those programs and services easy to access? Are they responsive to the needs and the contexts of the families that they're working in? What's happening in the broader physical and built environment? Are there exposures that are negative? Are there parts of that environment that are positive? How are we dealing with the environments of families who are displaced? Is there safe housing? And is there clean water and access to food and other kinds of services? And finally, there are systemic factors in all of our societies that are, again, actors on whether those are pressing on either the negative or positive sides of this scale. So I think as we think about the context in which we work, and particularly in these sort of crisis contexts, what's going on in the broader environment around families that is contributing either in positive or negative ways to the ability to create these kinds of foundations for resilience. Boiling all this down, hopefully, to something that's a bit practical here, I want to think about 3 principles. None of these will sound new if you've been listening, but we can use these to think about the programs and services that we're providing, and paying attention to these things in any way and in any place we're interacting with and providing services and support to children and families. How are we trying to reduce sources of stress? Sometimes that's difficult given the environments we're working in, but in any way that we can, paying attention to reducing those stressors on families and children, supporting these responsive relationships. And I think I've talked a lot about that responsive relationship between adult and child. There's also the idea of responsive relationships between service providers and adult caregivers. So in a doctor's visit, in a health clinic visit, does the parent feel heard? Do they understand that their own situation is being addressed and supported, even as the focus is on the child? So how are we ensuring that those service relationships, adult to adult, are also characterized by this kind of responsive, supportive dynamic? And then finally, how are we helping build adaptive skills? Are we providing opportunities for adults and children to practice building these kinds of coping skills, other kinds of capacities that give them a sense of agency and ability to deal with the environments that they're in? And I'll close by connecting these principles with the nurturing care framework, which I think has been a really important framework for all of us in the early childhood field over the last number of years because of its clarity. It's also very strongly grounded in this science. As we think about sort of early learning and skill building, that kind of safety and security as a way of buffering against stress, responsive caregiving, and of course, health and nutrition as critical foundational components of this. So thinking about how are, in whatever way, the set of actors and services that are being provided, and how in the health sector in particular, are we paying attention to all of these components to ensure that the services we provide and the care that we provide is contributing to the factors that build resilience in adults and kids. If you don't know about our center and our website, there's a huge amount of material on all of these topics I've just talked about, which you are welcome to go dive into. So I will close there. Thank you very much. And I will look forward to the ongoing questions and discussion from the webinar.
Thank you very much. Thank you very much, Dr. Cairns. Excellent presentation. And I just really, I'll take advantage of being a facilitator and maybe repeat a few things that really, I think are very, very important, especially for someone who is working in healthcare and dealing with children and parents affected by adversity or traumatic event or displacement, whatever you name it, on an everyday basis. Yeah, this accent on placing both stressors but also resilience, not inside the patient but in between, in the relationship, but also in the relationship within the family, but also in the environment and in relationship with the caregivers, service providers in a wider sense. I think that's on one hand very liberating for the patients, but also for the providers, at least for myself who worked in healthcare for a number of years. It was always much easier to do something what's in your hands if you understand that it can have impact, rather than thinking, how do I help this person, where everything is inside his head, and how do I deal with this trauma? It's not always trauma. Sometimes it's just that struggles that you face in everyday life as a displaced person. Thank you so much. And now I would like to give floor to participants. We have 10 minutes, unfortunately, for the questions. So please go ahead and ask them, raise your hand. Um, yeah, I think we don't have anyone, yeah, who would like. Yeah,
No,
Zorica.
no. I just wanted to say that I would like to share greetings from our colleague Vera Rangelova from UNICEF ECHO. She was observing and following the questions. So we have, let's say, 2 questions that we can start with. The first question is, could you, James, tell us something more specific? What kind of interventions could be integrated in routine health services that could support well-being and mental health service of young children and their families? And the other question is, in a way related, is how health and ECD specialists can support the family if everybody is affected with the toxic stress. If they're all under toxic stress, how then, for example, health system comes in, and what are the interventions that could help?
Thank you.
I'm sorry, Vera has some issues with the microphone and things like that, so that's the reason. But thank you, Vera, for supporting us.
Thanks, Zoritsa and Vera. So I am not an interventionist, so I don't want to stray too far into territory where I'm not an expert. What I do want to say is that I think there are 3 important elements in this story that should shape the kind of intervention we think about. So the first is this idea that thinking about the kind of health, mental and physical health of the adult and the child completely separately from each other doesn't help us in this situation, particularly for very young children. So as we think about interventions, what are we doing that's making sure that we're paying attention to the interactive reality of the environment in which that family is living? I think the second is that some kind of family therapeutic approach, if there's referral to or into a more sort of I don't know, advanced or more specialized kind of treatment, again, I think and there's a rich evidence base of different kinds of therapies that have shown some effect. But it's looking at, if we're only treating the parents' mental health issues or depression and not doing that in the context of how that's affecting the relationship with the child. I mean, that's the story here. It's that most importantly, for very young children, all of their experience is happening in that context of relationship. And so if we're not paying attention to that in how we're addressing challenges in either the adult or the child, we're missing an opportunity. I think that the third thing is the awareness of the kinds of factors that do support resilience. And so how are those who are in those clinical relationships looking at that broader environment? What kinds of, are there programs or other kinds of services that are focused on the skill building aspects of life and providing that kind of coaching and support in a variety of ways that can address those things, as opposed to just treating or providing information. Moving into that second question about supporting families when the entire environment is completely stressed out and traumatized, as is often the case in major conflict and other kinds of crisis settings. I think the key here is that responsive relationships for young children do not have to be provided by their parents or immediate caregivers. if those caregivers themselves are highly stressed out, are traumatized, are dealing with their own significant challenges, who else is available to be providing a stable, responsive, supportive environment for those young children? It could, and this is another place then where clinicians, other service providers, other actors or people in that community need to step up and need to be aware that if the way we're providing services to families is relying on the caregiver to be that support and that creating that responsive relationship largely on their own, if they're not able to do that, we need others in that system to step in and do that. It could be a teacher, it could be other kinds of counselors. What kinds of programs or settings are we putting together? But that's so for those who are coming in, if you will, into those environments of crisis, who are not themselves part of the group and the community that's been directly affected, it's kind of on us then to be the ones who are able to be aware of this, what's going on in these relationships, and providing those kinds of care and support. And I think the more that that those who are providing those services understand these dynamics of early development, it allows any of us then to use those principles to say, okay, is what we're providing helping reduce stress in whatever way it can? Sometimes that feels minimal, but little bits are important. Are we paying attention to and creating those responsive, supportive relationships around the family? And what are we doing to help sort of build those coping and resilience kind of mechanisms? So I think that's the way that we have to sort of tackle this.